So my name is Irene Castellano, and I am the national contact point for the Horizon Europe Health Cluster and also for the Cancer Mission. And I am the Ireland lead for the Cancer Mission. So today we are going to focus on the success Ireland has had so far in the Cancer Mission, how we have done since 2021 up to now, and the upcoming calls, both in the Cancer Mission but also in the Health Cluster, and opportunities for cancer research in particular. So I'll start sharing a video from Amanda Drury. She is in the Cancer Mission Board, and she will do a little introduction on what the Cancer Mission is.
I'm also a member of the Horizon Europe. Hello, everyone. My name is Amanda Drury, and I'm an associate professor in nursing at the School of Nursing, Psychotherapy and Community Health at DCU. I'm also a member of the Horizon Europe Cancer Mission Board, and I'd like to thank Irene and Liam for the opportunity to provide a very brief overview of the Cancer Mission for today's webinar. The missions are an approach to research and innovation that Horizon Europe set forward to provide a new way to answer the challenges that society faces every day. This is done through engagement with citizens and by placing people affected by cancer at the centre, driving the research and innovation agenda. The goal of the mission is to improve the lives of more than 3 million people affected by cancer by 2030. So that includes prevention and treatment, but also making sure that people living with and beyond cancer and their families can live longer and better lives. The mission is structured around 4 objectives: understanding cancer, improving prevention and early detection, supporting early diagnosis and treatment, and enhancing quality of life. And there are also 4 cross-cutting priorities that guide the work: equity, innovation, childhood cancer, and personalised medicine. What makes the mission approach different is that it's not just about funding research. It's about shaping a more coordinated, inclusive way of setting priorities, and that involves working with stakeholders across the system before deciding where research and innovation should be focused, and connecting work that's being done at local, national, and European levels through clusters. In terms of concrete initiatives, the mission supports several flagship projects. Uncanny U is advancing our understanding of cancer by creating a European federated research data hub. The European Cancer Prevention Centre is helping to translate knowledge into action on prevention. The network of comprehensive cancer infrastructures is improving access to high-quality diagnostics, treatment, and clinical trials across member states. And the European Cancer Patient Digital Centre will enable secure patient control sharing of health data across borders, with the aim of providing better care and supporting better research and survivorship outcomes. These are all part of a broader group of flagship initiatives in the area of cancer in tandem with Europe's Beating Cancer Plan, including new screening schemes, HPV vaccination goals, digital mapping of treatment capacity, and tailored support for children and cancer survivors. The mission's impact depends heavily on how it's governed. It isn't centrally managed, but instead built on cooperation between local, national, and EU level actors. Dialogue with member states and citizens is a key part of this. The mission approach involves two-way communication with working groups and structures in place to keep that exchange active and meaningful throughout the implementation of the mission. The ECHOS project, which is establishing national cancer mission hubs in every country, is helping to strengthen this connection. These hubs are raising awareness of the mission, coordinating national actions, and helping align research and innovation agendas with the mission's priorities. They also support citizen and stakeholder engagement, which is essential if we want the mission to reflect real-world needs and deliver real-world impact. So I'd like to say thanks once again for the opportunity to provide this very brief overview. Today's webinar will provide more information as we go forward, but if anyone has specific questions, I've included the Cancer Mission Secretariat's email here, and you can contact them directly. Thank you very much.
So thanks. Hopefully it was useful to have this overview from Amanda. She couldn't make it in person or live, but she very kindly shared this video. I will now do a little overview of the success that Ireland has had so far, as I mentioned before. 1 second. Here it goes. So Before I start, I also want to thank the All Ireland Cancer Research Institute and the NCCP for supporting this webinar and helping organizing and planning of the webinar, in particular Liam Gallagher, who will speak later today as well. So Ireland performance started in 2021 when the cancer mission started as well, and we've secured almost 8 million euros since the start of this specific program. It's been a different approach to funding, as Amanda was already explaining in the introduction. And while it's a research and innovation program, it has this multi-stakeholder engagement component that will make hopefully the aim of the mission being achieved in a more successful way. So in 2021, we started, and you can see in the first graph here, this is the funding Ireland drawdown in comparison with the total funding available. So as a percentage. So in 2021, we didn't reach the 1% of the funding available. It was 1.18 million that we draw down, and this has been increasing year after year. 2022 and 2023 were kind of similar in the amount of money we draw down, but it was higher than 2021, and 2024 was an excellent year. Like we did draw down more than 2.5%, 3.2 million euros, and we also got the first coordinator grant. So we've stepped up, I guess, our presence, and it's great to see also the more understanding of the mission probably helped for Ireland to be more engaged year after year. You can see on the right a graph on the success rate of Ireland in comparison, that's in green, in comparison to the success rate in overall for the cancer mission each year. So we've always been above average, but again, really 2024 was the best year in terms of the comparison with the overall success rate. I just want to highlight that 2022 was a little bit of an outlier. There was a very high success rate, probably because of the high amount of collaboration and support actions that were that year, but also the low amount of submissions that were that year as well, both by Ireland and in general. But nonetheless, we've always done above average, which is great to see. Very quickly to see which projects have been funded. Amanda was explaining there was 4 aims. The Cancer Mission has 4 aims, and they are clustering the projects under these 4 aims. So the understanding cluster, there will be all those projects that are contributing to that understanding aim. And sometimes they do activities together, and you might see some policy webinars around these clusters, highlighting the work done under each of those clusters. So these are the successful projects in Ireland. We will hear from Aideen later on the Candle project. This is the only 2024 project I've included because most of the 2024 projects are not signed yet, so they are not confirmed yet, but as soon as they are, we will publish them in the HRB website. We'll have a news story. In terms of prevention and early detection cluster, we have 4 projects successful here, 2 from 21 and 2 from 22, and there's a mix of universities and industry involved in here. Then the diagnosis and treatment cluster is the most successful. Also, more calls are in this area, and most of the projects we've been successful at are, again, research and innovation actions from different universities, but also Cancer Trials Ireland is involved, or Children's Health Ireland. We are involved in the Comprehensive Care Infrastructures for Europe project through Trinity College Dublin there, which is one of those collaboration and support actions for a flagship initiative that Amanda mentioned before. Finally, the quality of life cluster, it's not included because we don't have any project during these 3 years funded under that cluster in Ireland, but we do have in 2024. So we will soon see those there. Also, the quality of life cluster is the one that had less calls, so it makes sense as well. So we'll hear more about some of the projects now. Liam Gallagher will start with the ECHOS project, which is the National Cancer Mission Hubs project. It's not present in any of the clusters because it's a cross-cluster activity. So he will talk more about that. And then Jacinta O'Sullivan on the Endeavour project.
Project. The lead is led by the University of Antwerp, and I'll go into the mission of this. I suppose from the outset, I have had such a positive experience in engaging with the establishment and the rollout of this EU consortium. And I think, for me, the highlight has been that we have got, more international visibility. And while Endeavour is funded, a number of new applications are currently in the making across the different member states that are involved in Endeavour. So a very positive experience. So just to give you a bit of an idea of, why we were asked to be part of Endeavour, I suppose for many years through the umbrella of Precision Oncology Ireland and with co-funding from Research Ireland and the Esophageal Cancer Fund, we established Ireland's largest national Barrett's registry and biobank. And this has been very visible to our colleagues in mainland Europe. So we were a high volume centre and they approached us to be part of this European network. It's a 5-year grant. It came under the call of creating a clinical trial structure using minimally invasive diagnostics. So that was the call title. And this project really fitted with that. So Barrett's esophagus is, just to give you a little bit of detail, it's an inflammatory condition. And over time, these Barrett's esophagus patients that have chronic inflammation, a portion of them will go on to develop early esophageal adenocarcinoma and late carcinoma. And there's no way of stratifying which patients will progress and which patients will not progress. And, this consortium was very important. So we actually came together as a European network to have the power to address these clinical questions. So it's a 5-year project. It's carried out and it's now linking 7 high incidence regions of Barrett's cancers in Europe. And actually, we just had our annual meeting hosted in Ireland this year. And I would say that we probably have the highest volume of patients out of the high the esophagus and have progressed to early cancer, they can be treated with different technologies to really kind of burn away that diseased tissues. However, up to 30% of the cases will reoccur. So if we look here in this clinical trial, we're identifying and incorporating Barrett's esophagus patients with early cancer. They can undergo endoscopy treatment. And what we're trying to do is we're trying to identify those patients that will have stable remission versus the patients that will have a recurrent disease. And currently, we're doing high follow-up on all patients, which is not cost effective. It really influences poor patients' quality of life and poor satisfactions for our health care professionals. So what we're doing here is we're using scientific data using chromosomal stability patterns and applying it to the samples we collect. So both brush samples, tissue samples, and blood samples are all centralized now in this European Barrett's network that can actually be accessed by other groups. So this is another advantage of being part of these EU networks. So our goal of this program is to identify the high risk of progression to esophageal cancer and to increase the follow-up for these patients. And for the low risk of progression, which is quite a proportion of patients, to try and change clinical practice that, in a safe way to reduce the frequency of follow-up for these patients. How will this work in the clinic to improve management of Barrett's patients? So just to give you an idea of our timeline in running this intervention trial. So it's not just assessing the scientific biology of these samples that are going to be collected from the 7 high volume Barrett's centres, but also we're doing digital questionnaires with patients. We're doing online questionnaires and really assessing their quality of life, which is embedded into this randomized controlled trial. So with every randomized controlled trial, we have a control group and an intervention group. And throughout the course of the Endeavour project, we will have large amounts of follow-up on these patients, which will be a maximum of 3 years. So why do we perform this European Endeavour programme? Well, ultimately is to improve the management of Barrett's patients across Europe. And we're at a very strong stage at the moment where this randomised controlled trial is now being opened across the 7 different high volume centres. So the goal, the challenges here I've listed: low cost effectiveness. Our goal here is to reduce healthcare costs. We're very conscious that there's a poor patient quality of life during this surveillance program, and we hope that the outputs of Endeavour will improve the patient's quality of life. And there's a huge amount of poor satisfaction across the healthcare professionals in dealing and managing these patients. And the outputs on the deliverables of Endeavour will hopefully assist clinicians to make better informed decisions using a patient-centred approach. So really, I suppose that's a high-level overview. For me, being part and applying to these EU calls has been very beneficial on a number of different levels. It has now formed new collaborations. It has actually incorporated our national Barrett's biobank at a more European level. And the outputs of this work will significantly not only improve the way we manage our Barrett's patients in Ireland, but across Europe. So I suppose the big benefit is it really connected us as an island and our innovative biobank and registry with 6 other very active academic centres across Europe. And I suppose the benefit here is we're running a randomised control trial now across 7 different European sites. And without the funding from the EU structure, we wouldn't have been able to elicit this randomised control trial. So hopefully that just has given you a snapshot of the benefit to us, but most importantly, the benefit to the patients.
Yeah, thanks, Jacinta. I know I see Irene back in. So Irene, we just plowed ahead if that's okay.
Yeah,
what I suggest we might do is we finish off my case study. Maybe Aideen could provide some comments and then come back to your presentation on the success stories. What do you think?
Yeah, it was almost finished, so
Yeah.
yeah.
Okay, great. Okay, and again, I would encourage people to feed any questions into the Q&A, and we'll come back to it at the end. We'll either do them by addressing it on the chat, or we can get people to verbally go through them. So I'm going to talk about the ECHOS project. Sorry, put down my mail. You see my very messy desktop. Okay, so hopefully you can see the first slide there. So I'm going to talk about the ECHOS project, which is an EU project. It is a coordination and support action that was funded around the same time as it was a part of the same call as the CCI for EU project, which is also a coordination support action. So again, these coordination support actions are really, a lot of it is around networking and kind of knowledge exchange. That's the core focus of a CSA. So the context here is that as part of the EU cancer mission, there's a desire to set up national cancer mission hubs in each EU member state and associated states. So that's a specific call. And I'll talk to, I suppose, the elements of what a cancer mission hub is, but fundamentally it's a way of bringing relevant stakeholders together, both citizens, patients, academia, healthcare, and civil society. So there's 5 different audiences in a collaborative model, and there's some kind of functioning kind of cancer mission hubs, maybe not officially titled, but they're working quite well in different countries. And this project was really looking at various different models around Europe, looking at how you might establish different national cancer mission hubs in each EU member state. They don't all have to be the same type because we have to take into account different structures. And so this project was funded in the order of €6 million. The Irish partners are, it's led in Ireland from the National Cancer Control Programme, primarily driven from the National Cancer Research Group, which is chaired by Professor Donald Brennan. And then the All Ireland Cancer Research Institute is involved via the academic entity UCD. So again, the main focus of the ECHOS project is really looking at, I suppose, establishing national cancer mission hubs, but also importantly, a network to connect those national cancer mission hubs. And so the consortium brings together over 50 organizations across 28 countries, and it's kind of growing organically as we speak. So it's a 3-year project. It's coordinated from a Portuguese group at funding €6 million, and the main objectives are to promote the creation of national cancer mission hubs, and then establish a network to advance the cancer mission. So I suppose really operationalizing the cancer mission across Europe, and then looking at creating synergies, and also come up with essentially a framework for a network. And so there is a big focus around kind of building sustainability models for these cancer mission hubs. So in terms of the way the work is broken down, classic work package structure, but a key initial aspect was looking at the design of what an actual national cancer mission hubs looks like. And there's various different models. There's 4 main models which have been kind of come up with at varying levels of governance structure. And I'll come back to that in a minute. Also a big focus around stakeholder identification and engagement, and then also linking activities. There's lots of cancer programs funded at a European level between both the EU Cancer Mission and Europe's Beating Cancer Plan. And one of the challenges is that often, those programs they're not upfront connected. So what has happened is we have to kind of connect these laterally. So that's a key function of the cancer mission hubs, is to actually look at connections between projects as well. And then I suppose in the next phase of the project is really about once the cancer mission hubs are established, is having that strong network. And I think that's really the key value from the program, is learning from best practice from other countries about what works well there, and then that can be taken on board in your own country. This is from EU. This is what the EU expects cancer mission hubs to do. So raising awareness. So again, this webinar will be a good example. A year and a half ago, we organized the EU Cancer Mission Day, specifically bringing all the people together who have been funded under Europe's Beating Cancer Plan and the EU Cancer Mission. A one-day event in Herbert Park, and that was another example of what we're trying to do, is raise awareness of the programs and successes. Another key function is kind of securing buy-in and engagement, involving a big focus is on connecting research to policy and closing that loop. So there's a big focus around policy dialogues. And then there's a broader kind of context of, I suppose, fast-tracking innovations towards the clinic. Also sharing best practice, developing joint activities, and then there's broader kind of policy perspectives. So again, you have a mixture of different kind of organizations involved. You have some which is very closely involved in the ministries. You'd have some top-tier oncology institutes like Karolinska. And then you'd have policy-driven organizations. So it's a mixture of different types of organizations involved in ECHOS. So I mentioned these kind of 5 different kind of stakeholder groups. And again, that's a big theme of the EU Cancer Mission, but also Europe's Beating Cancer Plan, is bringing those different stakeholders groups together from again, citizens, civil society, public, business, healthcare, and knowledge and academia. And so from the initial work, there's 4 main models which have been identified as being kind of, example models for setting up a cancer mission hub. Some which have a strong degree of kind of legal framework. Some are looser, like a coordinated action, informal kind of structure. And so these models are kind of indicated as potential models that people can take on board. One thing that's been very useful is knowledge exchange visits, where we can actually go and look at what's taking place in other jurisdictions. And so, for example, I was fortunate to participate in a knowledge exchange program in Norway. They have a fantastic setup in terms of kind of prototype National Cancer Mission Hub, which has all the relevant stakeholders. They all come together very collegiately, and it's also very close involvement at the Cancer Society, the Research Council for Norway, Oslo Cancer Cluster, all very well integrated. So we can kind of learn from those kind of models and maybe look at what we can do in our own situation. So again, some people may be aware that there is a National Cancer Research Group. So some people on the call would be participants in that, chaired by Donald Brennan, which is connected to the National Cancer Control Program, which brings together funders, other stakeholders, patients, charities. And again, these are some of the activities, but I think that will be a key kind of driver. The National Cancer Research Group will be a key driver behind the establishment of a National Cancer Mission Hub in Ireland. And so what that group has done was we've organised 4 workshops where we asked the community, like, what do we want to do in terms of establishing a National Cancer Mission Hub in Ireland? And could we create a shared vision from those workshops and agree some key objectives? And so we 3 of those workshops were organised by the National Cancer Control Program, and one was organised by HRB, the latter one, where we brought different kind of members of the stakeholder community from either healthcare, patient advocates, and nursing and social care professionals, and academic researchers. And from that, the consensus really was that a National Cancer Mission Hub in Ireland should really be a focal point for national coordination of cancer research. Should drive stakeholder engagement, should be involved in policy dialogues, should really help in terms of creating national and European synergies. I think Jacinta gave a very good example of, a program in esophageal cancer that's also connected now to, you've got a European program, which is a national program. How do you connect those activities together? And a big focus also on knowledge translation and communications and outreach. So where is it at the moment? So the output of this workshop has essentially driven a kind of proposal from the National Cancer Research Group to establish a National Cancer Mission Hub. And this National Cancer Mission Hub would be, so it's gone to the Department of Health. So the initial model that has been suggested is that the lead agency would be the Department of Health. Okay, so it would have a more legal, kind of stronger legal footing with support from the National Cancer Control Program and ACRI as required. We're awaiting feedback from the Department of Health, whether they, from that proposal, they may push that back to us and we may take more of a role, but that's what the initial proposal has gone in based on the consensus. So it's more of a solid kind of legal footing for longevity. And just want to finish off. So what's currently happened with the ECHOS project is it's kind of like, I call it like soft OECI, right? Everybody's familiar with the kind of OECI accreditation process for the cancer centers. So this is what essentially, it's not so much an accreditation process, but it's a recognition system for national cancer mission hubs. And so the idea is that this is being proposed from the ECHOS project to essentially have a process where we have an application process for national cancer mission hubs. So they're formally recognized as a national cancer mission hub. And everybody starts at the start. So even if it's a very well-established national cancer mission hub, they start at the start and hopefully progress. And these are some of the kind of indicators of less mature or more mature national cancer mission hubs. And ultimately, I suppose the purpose of this is to, I suppose, just formalize what a national cancer mission hub looks like in each EU member state, which also will have impact down the line in terms of networks, etc. So I'll leave it at that. I just want to finish off by saying, so this program is ending next year. There is an open call. I assume it's officially launched now for essentially a follow-on program. So that's an open call that people can submit for, but certainly the current ECHOS partners are actively putting a proposal together for that call, which is open for enlargement and expansion as well. So that's going to stop sharing here.
That's great. Thanks, Liam. A very good overview on the ECHOS project. So yeah, next is Aideen. So She's here now. She'll give us an update on the Candle project, which will start soon, but more generally on the uncan.eu platform, which is one of the flagships of the Cancer Mission. And you will see that word everywhere in the call text of every call that is coming up. So pay attention to what Aideen has to tell us.
Can't hear you, Aideen. Sorry, you're muted. Can't hear you. So you have to unmute yourself, or can you unmute yourself?
Okay, 1 second. I am just trying to work out. I'm just going to share screen, I think.
We can hear you now.
Okay. Share. And okay, so I'm just going to make this bigger. Please tell me if you can see the slides.
Yeah, we can see it. Yeah, great.
Okay. So when the call came for data nodes, there were a number of different data nodes that uncan data nodes that were being proposed. The one that we ended up joining wasn't the one that ended up getting funded, and I don't know if anybody joined the one that did get funded. But we also joined Candle, and I'll tell you about that. That is the coordinating and support action around uncan. So there are two big platforms, technological platforms that are going to be developed. And one is uncan.eu. So that is the National Cancer Data Node. And it will really bring experiences from the genomic data infrastructure and from Elixir together in order to develop a standardized node whereby you can have federated sharing and analysis of cancer data. And by federated, it means that the data stays locally in each country. But you can securely access across border. Now, within the Irish context, we have a lot to do to set up a national cancer data node, which provides fair sharing of data in Ireland. There's also the Cancer Patient Portal, and these were funded under two separate large funding. These, I think, Irene, you can probably tell me how much went into each of those. These were both two pretty good big grants. This was 01 and this was 06. And the CSA then is basically to enable communication between the data node and the patient portal, which will provide permissions to access the data. And then also between the data users. So patients, authorities, researchers, healthcare professionals. Oh, sorry, I didn't mean I had to have CC on there. Okay, so there's 40 members in the CSA. This is being led by HRB from the Netherlands. We work quite closely with them on some of the projects within the Genomic Data Infrastructure project. Elixir in EMBL is also, and EMBL is also a significant partner, as is the Barcelona Supercomputing Center. And that's also a partner within a lot of the uncan work as well. Why are we involved? Well, we're doing a lot on data infrastructure in Limerick. We're the technical partner within the genomic data infrastructure. So setting up the DevOps and the actual software to enable sharing of GDI data. I'm head of the Elixir node in Ireland, which is only very recent, that's only in the past week. So the aim there will be very much to expand the role of Elixir in Ireland such that researchers can actually avail of what's available within that. In the US, I was very much involved in the oversight of Bioconductor and building cloud platforms to enable standardized workflows of Bioconductor on the cloud platform that was at the Broad, which was the Terra platform. Within Ireland, I'm running a north-south program with Mark Lawler called eHealth Hub for Cancer, which is focused on sharing of data and building up the standards and for sharing clinical genomics data. I'm also working within Odyssey, which is a very big program for standards for sharing federated clinical data. We also work within GA4GH, and we recently were part of the group that decided what should be the minimal data set in cancer that should be shared within the GDI program. That model has since been updated. We've just submitted an ESMO abstract, sort of refining that model and creating the database infrastructure, which should then basically standardize sharing of cancer data, towards standardized sharing of cancer data. So we're collecting enough clinical data to be able to annotate the samples. Okay, so these are kind of the work packages within Candle. So part of it is just doing a landscape analysis of what is the data infrastructure for data sharing in cancer, and how is that formalized? Is it a case of siloed little data sets in individual labs, or is there actually a national architecture with things like a European Genome Archive for sharing of genomics data in a secure and scalable way? Developing best practices, looking at the obstacles. Then the next part of that is very much doing that coordination between the patient platform and the data platform, looking at compliance with the European Health Data Space. European Health Data Space is mandatory. EU legislation, which was passed earlier this year, which requires that health data is available for research. Connecting with myhealth.eu and health data.eu, so that's part of the European Health Data Space. Within GDI, we're doing a lot already with EHDS. And then developing maturity models, and I'll explain what that means in a second, and developing kind of roadmaps, and then just communication side of things. So the main part of it is then connecting into the uncan.eu to be aware of how that's developing. That data platform will be rolled out on a subset of countries, but obviously more countries will want to have the information of what's happening within UNCAN. And then equally, UNCAN here will develop the platform, it'll develop tools, and it will have a portfolio. It's quite a small portfolio from what I understand of cases there, but Candle will be feeding into that. And equally on the other side of it with the patient portal, so patients will know where their data is, what studies their data is enrolled in, and they will have to give permission. And under GDPR, they also have to have the ability to withhold consent or withdraw consent if they choose not to partake in a study. So therefore, technically underneath it, we need a layer that connects the patient portal. So has this patient given permission that their data be used in this study, with the actual data platforms, whereby we know which researchers are accessing the data and for what purposes and for what studies, that they basically have the ethics and data protection in line, and basically connecting those underneath. And this is also a lot of what happens within GDI. It gets quite technical very fast. So the expected outcomes is synergizing the data infrastructure, the data-based research, cancer care, public health, removing the barriers to effective implementation of both the data portal and the patient portal, and supporting the mission. Okay, and this is just a final one here, these are just figures that we put into the grant. And this is basically, just to summarize, so Candle is basically a coordinating and support action, which connects the data platform, which is uncan.eu, and the patient portal, and other than data users and stakeholders, and will connect then the countries that aren't part of these grants, which Ireland is one. So it's really important that we're involved in this CSA. Okay, I will stop sharing. If anybody's got any questions, I'm happy to answer.
Thanks. Yeah, so we don't have any questions in the Q&A box, but if anybody has questions, please feel free to add them. We can answer at the very end of the webinar as well.
It might be worth getting somebody just to check if they can actually submit a question, because when I wasn't a panelist, I couldn't
Yeah.
do that.
Yeah, I know I've gotten a few questions in there.
Yeah.
Not chat, but they can ask questions in the Q&A box. So again, if people want to verbally do it, just indicate, and we can sort it
Yeah.
out.
You can also raise the hand, and then we can give you access to talk.
So a question I had just for yourself, Aideen, just in terms of on that uncan.eu, so that's the larger scale program. That's a 30 million euro program, isn't it? Which has the use cases, and who's coordinating that?
So both the patient platform and the Uncan these are really big grants. I don't know all of we haven't met yet as an organization. We're just signing the paperwork at the moment for Candle.
Yeah.
It should be done for the 1st of June. And we're meeting then, the first meeting of Candle will be later in the month. And when I know more, I'll tell you all of the details.
Yeah, you know, it's just because ultimately, I suppose, when they talk about uncan.eu in the call text, are they talking about the data nodes? Are they talking about the use cases? That's a bit of lack of clarity. So because
So,
sorry, go ahead.
within the Uncan grant that we were under, generation of data was pretty small.
Yeah.
The vast majority of it was the technical platform.
Yeah, but it's more the fact that, like, to guide people going forward for the next calls, they talk about intersecting with oncan.eu. So is that intersecting with the project which has the use cases, or the data nodes, or both? Like, so Irina, it might be useful to get some clarity on that from the Commission, because it's a general term, because there was a previous oncan.eu project which I was involved with, which was an original CSA. And then that put out a kind of a design of the potential next calls, which you have these calls coming out. So what we want to be able to do is kind of advise people, how do they interact with the uncan, who do they interact with and how they interact, because otherwise it's a closed shop for people, if you know what I mean. So you need to have a way of getting in. Otherwise it's not fair. And I'll be kind of relaying that at a kind of public health expert group level if there isn't that clarity.
So if I can add, or Aideen. Yeah, I think we need more clarity, but a little bit of what I understand is that, well, the platform is on development, so the platform is not there yet, of course. So the use cases call that Ireland is not involved in, that one will develop use cases and will develop data that will start to build the platform. And then the call Aideen was talking about, it will support all that stakeholder engagement and make sure the platform develops with everybody involved as well. So I'm not sure what would be the best way to engage in the future, but at this moment we are engaged through Candle. So for sure, I would say that's a way for Irish researchers to engage, or by your partners if they know more about that main use cases. But the idea is, if you have a project and you are generating data, the idea is that this new data that you are generating in the project will be able to be added to the uncan.eu platform that will be developed or that is in the process of development. So your data has to have those standards so that it can fit the platform, those high standards. That's a little bit of what I understand at the moment, but yeah, it's...
So in order for Ireland to be even part of uncan.eu, whereas we can maybe generate data, and we have to have the national infrastructure to host it, and we don't have it at the moment. So in other countries, they have developed kind of the Elixir infrastructure. So they have the central databases, they have the fair data sharing. If you generate genomics data, you have a national repository that stores that data securely, and that then you can search that data, you can find out what's there, and you can request access. And that's for both imaging, for, like, we're not part of Big Picture in EUCAM. Within GDI, we're still trying to identify what the national node is going to be and whether that's going to be a different national node for cancer compared to rare disease. But the historic development where every place just silos all their own data is not consistent with the vision for fair, findable, accessible, interoperable, reusable data and open science. And the Open Science Network in Ireland needs a lot of investment, and it needs to be able to develop if we're actually going to be part of these European platforms, because on multiple levels, from the levels of ELSI and the ethics and data protection to actually the physical hardware and the data centers to store this data.
Yeah.
So this is in order for us to be leaders or to be members in this, we have a lot of national growing to do.
Yeah, but I suppose like fundamentally what's coming, like the EU Cancer Mission is an open process, right? So people can put in a submission. So to make us competitive, we need to align with programs which are connected. You know what I mean? Because again, the participation can be also from the point of view the clinical question and the cohort. So there's different types of participation. So it's more the mechanics of maybe we can kind of take this offline. I don't think the EU have really sorted that out either, to be honest. Like the route of how people, because they've peppered the call document with oncan.eu, but they actually have done that before even knowing what is the end product in terms of the first application. And that, so it's kind of it's running before you can walk. So that's what the nature of the call topic. So we might defer that because ultimately, I suppose we need to kind of give some kind of clear guidance to say, look, contact the coordinator of this program if you want to get involved. Contact this person if you want to get involved. And then, you know, because there's forthcoming applications which say that needs to be connected with the platform. So we need some kind of clarity around that. But it might be useful, Irina, just to maybe finish off your presentation and then feed it out. Because again, I suppose what we're trying to do is build awareness of what's coming down the track. Ideally, which we still don't have, is we don't have a strategic group which says, "Oh, this makes sense for you to apply," and like that. Still, we don't have that, which is it's a bit of a free for all, which is fine, but ultimately, it's not a strategic, coordinated approach to applying for these programs, such we maximize success from an Ireland incorporated point of view. So, anyway, so Irina, do you want to maybe finish off to give the kind of broader perspective of?
Yeah, I'll go now and speak about the calls that are coming up in 2025.
Yeah.
Yeah, 1 second. Okay, so just to finish off, I think this is where I left. We don't have any projects in the quality of life cluster, but we have in 2024. So they will come up. Also, there were not that many calls in the quality of life cluster either, so it makes sense we didn't have projects in this area. But I will just go now about future opportunities for cancer research. So this is also a little reminder that you can find funding for cancer everywhere in the Horizon Europe program. So of course, in Pillar 2, the health cluster, this is top-down collaborative projects that tend to be around TRL 3 or more, and the cancer mission, of course, as well. They are also top-down calls to fund collaborative large projects. But we have Pillar 1 and Pillar 3, which are bottom-up programs. And there you can find the European Research Council and the Marie Sklodowska-Curie program, where, of course, there's plenty of funding there for cancer, and the European Innovation Council as well. Other programs are the EU for Health program. This is a program that takes results from Horizon Europe and try to bring those results more into practice. And there's loads of funding there for cancer. And Amanda Daly, actually, it is the national focal point if you are interested in this program. And also the Digital Europe program, of course, that's only for digital health, but there's opportunities there as well for scaling up solutions. So where are we in the cancer mission? We are in 2025. The work program has just been published. So yesterday was added into the funding and tenders portal. You can go and find the work program there for the cancer mission, also for the health cluster. And what we have 117 million in the cancer mission this year, similar to previous years, similar type of budget. Calls are closing on the 16th of September, and there are actually 4 research and innovation action calls, which these are completely open, and there's plenty of opportunity there for Ireland to be involved. We have 2 collaboration and support actions and 1 innovation action in collaboration with the city's mission, which has a different deadline on the 4th of September. So these are all the calls I've just mentioned. So the first one, I won't go into detail into that because it's only for cancer funders. And then you have the next 4 calls are research calls. I'll go into details now to that one. And the 06, number 6, it's the one Liam was talking about on supporting the National Cancer Mission hubs. So that will be a continuation of the ECHOS project, hopefully. And the last one is that one in collaboration with the city's mission. So going just very quickly through the research calls, which are fully open, and I do think there's plenty of opportunities for Ireland here. We have one on understanding the effects of environmental exposure for the risk of pediatric, adolescent, and young adult cancers. So really, this is about biomarkers to quantify environmental exposures that are associated with cancer onset. It's a topic under the understanding cluster, so it will be maybe a bit more lower TRL than other topics in these other calls in the cancer mission. So the next topic, it is a clinical trials topic on innovative surgeries. The focus here are patients with locally advanced or metastatic disease. So it's a very specific cancer patient target because it's been a very underserved population, as this type of patients normally cannot enroll in clinical trials. So the cancer mission is really trying to target populations that normally haven't been the focused in cancer research so far. And this is one of those topics. So really, it's a clinical trial topic. If you are interested, we can go. Send me an email. We can go through all the extra details that you need to fulfill for a topic like this. The next one, it's another clinical trial topic. It's an investigator-initiated multinational and early stage innovative clinical trial. And the focus here is pediatric cancer. So again, a population that has been underserved. Drugs for cancer normally have been developed for adults and they're then adapted for children, but this brings a lot of side effects and they are not really fit for purpose. So the focus is either children from 0 to 14 years of age at the time of the first cancer diagnosis, and or adolescents. So this is 15 to 19 years. And it's to develop early stage clinical trials, phase 1 and phase 1/2. Again, I want to highlight in all these topics, they do say one of the points you have to cover is to link or to support the uncan.eu platform. And this is why we had that conversation before. How can we do that? But as I said, just come talk to me and we can see the different options. The next topic is a pragmatic clinical trial to enhance quality of life of older cancer patients. So again, population is very targeted, 65 years and older through nutrition. So it's to develop this either a randomized or a cluster randomized academic investigator pragmatic clinical trial to validate nutritional care oriented interventions as part of routine cancer treatment or cancer care. So another clinical trial topics also linked with uncan EU. And the last topic included, it's in collaboration with the city's mission. Actually, it's been led by the city's mission. And the way the topic is written, you can really see it's been written by the city's mission. It's not how health topics are being written. It's a little bit different. And the focus here is to increase walking and cycling. And one of the impacts is to increase, to improve health benefits, including cancer benefits. The link with cancer is a bit loose here. However, there's a lot of background in the scope of the call talking about how the reduction of emissions will help reducing cancer, and also the benefits for cancer patients of increasing walking and cycling. So that's a little bit where the link is here. If you are a cancer researcher, you won't lead this talk call, but you can join as a partner for sure. And I want to finish up also reminding everybody that the health cluster is a much larger program. There's plenty of topics. There's more topics that you can see here.
Okay.
Yeah, Liam?
Apologies. I had a sound there coming in. 1 second. I should go mute. Apologies for that.
Okay, no worries. So yeah, just to finish up, Health Cluster has a lot of funding there available for you all, so don't forget about it. I've selected 10 topics that I think either are relevant for cancer or you can make them relevant. And these 10 topics already represent 400 million, so much more of the funding available in the cancer mission. For example, I'll give the first example. It's advancing knowledge on the impacts of micro and nanoplastics on human health. So these type of topics are disease agnostic. So you can leave and have a proposal that is actually disease agnostic, or you can choose to focus on cancer health. So this is the case for many of the topics that are here. Also, the tool destination, for example, you can see from this line over here, it's all about developing tools. So they always are disease agnostic, is developing tools for something. So they are a great destination to look at as well for cancer in that sense. 3 topics I'm going to highlight because they actually mention cancer. The others, they just don't mention any disease, but these 3 mention cancer. The one is the tool 01 enhancing cell therapies with genomic techniques. These are research and innovation action. There's going to be 5 projects funded of 8 to 10 million, so large projects, and one of the targeted diseases that they highlight is cancer research. So great opportunities there. Another 2 topics are the generative AI topics. So these are generative AI topics for healthcare. The first one is end user-driven applications of Gen AI models in healthcare. So they are general models, general calls and topics, not focused on cancer. But again, you can focus them on cancer. And they mention different cancer platforms and infrastructures that you must link with. So even if the focus is not fully cancer, you definitely need to link with some of these cancer infrastructures. And the same for tool 03. So this one is on leveraging multimodal data to advance Gen AI applicability in biomedical research. So some opportunities there for cancer research as well. Don't forget about them. And just a little reminder of the Horizon Europe Health Guide for researchers we have in the HRB website. We go through all the phases that you have to go through before applying and submitting a proposal. So it's quite detailed, and it can be useful, especially if you are starting and you are a newcomer. And upcoming events that I want to highlight are the Cancer Mission Brokerage event online on the 26th and 27th of May. You can register now, and this gives you access to this online platform that will keep open for a few months as well after the event happens. So I highly encourage you all to sign up here, as normally there's thousands of people engaging in this platform from all around the world. The Cancer Mission Info Day, this will be hosted by the Commission, and you can actually ask questions directly to the policy officers in the Commission in charge of the topics. So if you are thinking of applying, it's great to join that, to have the opportunity to ask questions directly. Also a health cluster info day with the Commission. It's on the 22nd of May. And the last one I want to highlight, it's an event I'm organizing with Intertrade Ireland. It's a brokerage event with Northern Ireland, and it's going to happen in Dublin in our CSI on the 29th of May. So again, register to that. It's going to be for Horizon Europe Health Cluster calls, but also the Cancer Mission calls. So you are all very welcome to all these events. And please don't hesitate to contact me. I'm here to support everybody who is planning to apply or is thinking of applying at any stage, from never heard of Horizon Europe before to actually already have partners and being engaged, but have small questions about the call text. And just encouraging everybody to sign up to the HRB monthly newsletter. And also we have the horizoneurope.ie website with a lot of information on Horizon Europe. And the Health NCP network has a lot of information on health calls. It's a great resource. They have a great calendar there. They have success stories of health cluster projects that have been funded. So I really encourage you to also look at the healthncp.net. Thank you so much.
Yeah.